Patients come to my office and they're complaining of symptoms that are suggestive of a disc herniation in their low back. Usually they're having back pain predominantly in the lower part around the waist or down into the buttock region. The pain typically radiates into the back of the leg down into even as low as the calf and ankle. That usually means that when that disc bulges or protrudes out, that it's pressing on the branch of the sciatic nerve going into the buttock and leg. Patients ask what caused disc to herniate. There are many different things that get discussed, mainly traumatic type of events like improper lifting maneuvers at work. Sometimes motor vehicle accidents can cause disc herniations, and I'm talking mainly about the lumbar, the low back area now. Sometimes patients don't recall any specific inciting event or injury. It's something that just happens. Sometimes they wake up with a little pain in their back and it just goes into the buttock, into the leg. But most of the time in the low back region, it relates to some type of a lifting or some type of an injury itself, a fall for that matter. A disc herniates when the outer lining of that disc, which is like a fiber mesh, it holds the central juicy part of the disc in place. So that fiber mesh gets a weak spot in it, kind of like the weak area on the sidewall of a tire, and then the disc material, the juicy jelly-like cushioning part pooches through that weak area. And basically, it's like the weak spot that allows that material to pooch out through there. And when it protrudes through that area, it pinches or presses on a nerve that is locally in that area, and it causes pain in the distribution of that nerve. When patients come to us with lumbar disc herniations, obviously the conservative efforts are very important. Most of the time, it'll be the use of some medication, muscle relaxants, anti-inflammatory medications, judicious use of pain medication. We're great believers in physical therapy to try to help restore some lost function and to strengthen the surrounding areas. And the modalities that therapists utilize can also help a lot of that pain. We're basically trying to give things some time. We know that about 80% of disc herniations will never need any type of surgery. So we're just trying to buy some time and do some conservative things to get them pain relief until the body's healing ability takes place. The surgical treatment options for lumbar disc herniations are really basically just to remove that part of the disc that's ruptured. Unlike in the cervical spine where the disc really is not functional anymore, we have to remove it and replace it with bone and do a fusion. In the lumbar spine, rarely is that necessary. The disc in the lumbar spine, even when we have a big herniation, it's really only about maybe 5% of the entire volume of the disc that herniates. So we remove the herniated part of the disc, and that's done in a microscopic, what we call minimally invasive approach through usually about a 1-inch incision. And basically we're just removing that part of the disc that's ruptured. We're leaving the rest of it in there because God put it there for a reason. It's there to provide cushioning and support for the spine. So we're not going to do anything to disturb that. Usually there's enough left behind to do the job.